Today we show how elastopathy works, at least the basics on this, because there are, after all, many different therapy methods who work according to this method. Elastopressure consists of two parts. The first part, that is the preparation of the musculature, by making the muscle elastic. And this is done by pressing on the muscle insertion. And today we treat all the muscles that are responsible for back pain. And especially the muscles responsible for surfing, so that the hip hyperextension works perfectly. And the second part of elastopathy, which is that you then have, with daily stretching exercises, keeps the muscles elastic. You can do that either by doing it yourself every day, stretching exercises, or you can just do the elastopressure part. Make beforehand by preparing the muscles, and then daily use the Sturfer, the option you use at your desk to stretching exercise automatically. Today here without having Sylvia, any effort. She will accompany me today and we will together here to show the exercises. An important preliminary remark is, of course, that what I am now showing here is not something you should do yourself, but it's actually necessary to see a therapist who can get you pre-treated, but so that the therapist knows exactly what he has to do. Show. I hear exactly how it works, but please do not treat yourself, but see a therapist. The most important treatment point for back pain, just like for bulging and herniated discs, is the hip flexor, the psoas muscle, that's too short in most people. You can find it here in the front bar. To do this, you take one leg and you put the leg here on your leg. Off, if you are the therapist. And then you go about 3 inches below the inguinal ligament here. So right here between the crotch and here the groin. This is where the inguinal ligament runs. About 3 inches below that, you feel a little gap there, and you can show this gap a bit more clearly if you now here your knee here against my hand. Exactly, then such a gap arises here, and exactly in this gap you're reaching deep. It is best to use the thumb, with which you can build up a little. And with your thumb, you push in there, and you see the Sylvia. She reacted a bit. That is there in the depth. There is the hip flexor, and on this muscle, you have to press on it for a long time, on the bone there. This is the small rolling mount, or you press on it for a relatively long time. And you have to press so hard, press on it that you feel a distinct pain, but so that you can still stand it well. It is necessary to press until about 30% of the pain caused by triggered has passed. This is the insertion of the psoas muscle, which is the main muscle that first was responsible for back pain. The printing time is about 2 to 3 minutes in most cases. However, it can also be the case that if someone has really severely shortened muscle has that, it takes a little longer, but it can also happen that it only works for a minute. So how are you? Getting better. What percentage approximately? 20. Okay, then we do a bit more until the point all the way down. Switch to about 70% of its original pain. As you can see, I have quite an outstretched arm here, and I put pressure with my whole body here on this muscle insertion. That's about 10 to 20 kilos of pressure if you put that on, or if a scale wants to try out. But always press only as hard as the other person can stand it. If it's not 10 to 20 kilos, then it's perfectly okay. But it is really important to exert strong pressure here. How are you doing now? 70, okay. Then release very slowly. When you let go, it often hurts relatively badly. There may also be times when small local bruises may occur. Therefore, it is recommended not to about once a week every day. Muscle should be treated about 3 times. Subsequently, one would then use the same muscle on the other side as well. Of course, I won't show that now. You can imagine it yourself. The next point we're going to pick, that's the anterior thigh muscle. To do this, it is necessary to first seek out the 2 hip spines. Uppermost points to be palpated here on the pelvic bone. From there you go down and inside. About 1 to 2 centimeters below and inside of this bone here in the front. from the spina iliaca anterior superior. Again, you go in with your finger, make as much of a long arm, and then press here very firmly on this muscle insertion. This is the muscle attachment of the rectus femoris muscle, which is the anterior thigh muscle. There also has a large share of back pain. How are you doing here? Hurts? Okay, but is bearable. Okay, now we also press again. So 2 to 3 minutes until Sylvia says she is better. We do the whole thing on both sides, of course. This means that this point is also pressed on both sides. Of course, we don't have to show all that in the video now. Now comes the next important point. The one who wants to do quite a lot for the front of the body, can also still press this muscle right here on the middle of the thigh. This is the vastus intermedius. There are simply the 2 fingers here in front, so pressed on the muscle, and this also contributes a bit to the fact that here the tension drops a bit. Who for the abdominal muscles also still a little relaxation would like to bring, which should press here above on the pubic bone. The best way to do this is with the 2 thumbs, here about 1 to 2 centimeters. And then keep apart here the top from the abdomen in the direction of the pubic bone. Press down. And there it is usually very, very painful. And also stay on it here for 3 minutes. But I wouldn't wait here until 70% is down, because that's often necessary for much, much longer. Pressing here, it is often impossible to do in one sitting. Those were the important points on the front of the body. So you have actually most of it already done. The back of the body ensures that the hollow back is held. What was originally once triggered by the psoas muscle. And that is why we are now treating points on the back of the body. You may lie on your stomach once, Sylvia. The next important point is the insertion of the iliocostalis muscle. This muscle runs from the pelvis up here to the ribs. You choose here the edge of the basin, that is where here the basin in the iliac crest posteriorly passes to the sacrum. There's a little edge that's palpable, and you go on it with your thumbs. It's best to use both thumbs, press here. There we are likely to trigger a pain. I see a little bit of a reaction to Sylvia's face. It hurts a little there. Again, press the 2 to 3 minutes you need until the pain switches down to 70%. You do the same thing on the other side. And then you go up a little bit further and you take both of your thumbs and presses you on the highest point of this pelvic bucket, but not from behind. But neither from above, from the back, from the flank in the downward direction. It will hurt a little bit, and that's just the approach of the quadratus lumborum. And the shortening of this muscle is also responsible for a great deal of pain. These were the main muscles that we should treat to improve back pain, but also to make a preparation to be able to surf without pain. There are 2 more points that I would like to bring to your attention, which I would also consider to be very, very important, but which are not quite essential. And that is that you go once with your fingers here on the spine, along and with a distance of about 4 centimeters presses. You hear from top to bottom. These points are not painful for everyone, but you can, even here in many cases, release muscular tension. In particular, the musculus multifidus is yes here and lies here, on top of the facet joints. You can then go up the vertebrae one at a time, and I would say about at the lowest 3 lumbar vertebrae and then finally still. The transverse processes of the vertebral bodies. These are about 6 centimeters from the center, and there is the end of the muscle, there you feel a small gap, and in the depth there you feel the transverse processes of the vertebral bodies. And that's where the psoas comes in. This is another very important point. Here also treat on 3 vertebrae, i.e. L5, L4 and L3. And that again, of course, on both sides. If you still have a lot of desire, then I still show you the special point. And it is here on the side of the spinous processes. There you press also here directly to the spinous process laterally and look simply the place where it hurts. And of course, that's a total of 6 points again. So, from the third to the fifth lumbar vertebrae on both sides. Yes, that was the preparation of the musculature by elastopressure. The means through the pretreatment of the muscle to make it elastic. This is part 1 of elastopathy. Now, of course, comes the part of the stretches. That is now the muscle actually completely stretchable. Whereby after one treatment, not quite. I think you need to treat each muscle about 3 times. After all, there are various therapy methods. There are several pain management procedures who use this therapy. So you can look for a pain therapist in your area who has some understands elastopathy, elastopressure, or osteopressure, the elastopressure. And osteopressure are synonyms. And elastopathy is the technical generic term for these types of therapy, which pre-treat the muscles by pressing on the muscle insertion to make the muscle elastic. This was the introduction to elastopressure. And it was now here about the elastopressure, so the preparation of the musculature. And now we come to the part where we do the appropriate stretching exercises. In this video, I will show you what exercises you need to do to stay pain-free if you start with a pre-treatment, for example, by elastopressure have become pain-free. Because then you have to do stretching exercises every day in order to maintain this condition. However, the stretching exercises we show here are prepared stretching exercises. That is, they are not stretching exercises that we simply do without first to have treated the musculature. It is extremely important to first look at the muscle insertion of the affected muscles to have pressed. I explained this in detail. We now do a stretch of the anterior thigh muscle. And for this, the Silvia reaches here now times behind and pulls her leg here to the buttocks, as you can see. The Silvia is very, very well stretched. In this respect, it comes here directly with the heel to the buttocks. If you also already come so far, then there is a possibility that you here, a little below the knee, then you can get a little more out of it. Note then, however, that the hip really rests on the front of the mat. Make sure you keep pushing your hips down, then you add a little more stretch. Which of course is then necessary that you hold this stretch for about 30 seconds. After that, this muscle that you want to stretch should be briefly stretched once for about 10 seconds. Will you do that, please? Exactly the same. And this means that she now tenses this direction and must counter this with her hand as hard as she can. This is important to get more stretch out of it. Okay, then after 10 seconds, loosen up again and continue stretching. After all, but with the vast majority of people, to the extent that that does not get any further. Now still goes a little further. You should do this a total of 3 times and press against it for 10 seconds and repeat the whole thing twice more. After all, the most important exercise against back pain is stretching the spine. For that, you do a lunge like this. It is best if the front leg is not yet bent 90 degrees. You see the angle in the knee is a bit open here, and the second leg, which is at the back. Now you take your hand here, and with this hand you drive here underneath. The buttocks into your buttock fold. Then push the buttocks forward here. And then you still turn the body in the direction of this knee. Exactly. So turn a little bit in this direction. The goal of this exercise is to create a pull here at the front of the hip flexor. Is the train arriving, Silvia? Mm-hmm. And you do that again for 30 seconds and then you press for 10 seconds very firmly your back knee down into the mat. And hold that very tightly for 10 seconds as well. Then release again and come down a little more. And then once again press the knee firmly down into the floor. Very tight, tighter. The back knee now presses her more firmly into the ground. Now release and come down further. Exactly. And then it goes on, and then the back hip after pressed forward in the direction of the knee joint so that as much as possible of the pressure just arrives on the psoas muscle. The Silvia is holding onto me now, but it may be necessary to put a chair next to you or a table at which you can hold on so that you don't fall over. And of course, again, it is necessary to treat both sides. The last exercise is relatively simple. Let your arms hang down in front of you for 3 minutes. Let hang down, that we get a nice round back to here. Stretch the muscles of the back as well. Alternatively, you can do it sitting down right away, or you can simply take the natural squat, because there you also have a round back. Yes, thank you very much for joining, Sylvia. Thank you. Now, you can do those stretching exercises now, right? Alternatively, it is of course also possible that you use now we'll show you the exercises that you, instead of doing them on the floor, can do on the Sturfer to stay painless. If you have previously become pain-free with therapy, for example, with elastopressure. You can of course do all the stretching exercises on it, and you need to use therapy is not compulsory beforehand, but we recommend it. Absolutely. Because your muscles then simply give way much more. And because it is more elastic, because it is longer again, and because much less stretching. But to avoid having to do stretching exercises every day to keep your stretching ability, and in order not to start again from scratch each time, to start, there is the Sturfer here. This is a normal ergonomic office chair. We are now converting it into a Sturfer, which can be done in 3 easy steps, and then you can simply do your daily stretching exercises on it without getting into to have to make an effort in any way. The first thing you do, you reach down here, you pull the Sturfer upwards, folding the armrest away and upwards to the pelvic press. Then you need to turn once to the other side, and you can you go to the desk. Yes, Sylvia, would you like to join us? So Silva leans forward, goes up on his toes. Then we drive all the way under the buttocks, drive all the way in, and then go down again with the feet. This is now already the first stretch, namely 25 degrees overextension of the hip flexor of the psoas muscle. This is the muscle here in front. This is now here even, not so much to notice. But if you do this for a longer period of time, then it's quite a challenge. Beautiful stretch, which is clearly noticeable. The big difference from sitting is of course the following. We have many hours. And if you need a stretching exercise for 3 minutes, then of course you will never have these many hours of sitting balanced. With this, however, it is possible to really compensate for your muscle shortening, because just as long as you sit, you can also stretch the second most important stretching exercise, which is indeed the stretching of the anterior thigh muscle. For this we take a leg here and then put this tape around it. Then we can stretch more or less here, depending on the intensity of stretching. By tightening the bun here, we can significantly increase the stretch. The most important 2 stretching exercises, we've done them now. Now we stretch the back and buttocks muscles. And for that, Sylvia puts one leg forward here now. You can either just let that hang down here in the front. To stretch the piriformis muscle, it is possible to then stretch the leg here in front, to be placed on the upper leg support. And now we have a perfect stretch of both the hip flexor muscles on the right side as well as the gluteal muscles on the left side. And so it is now very comfortable, easy to work, and besides stretch, very pleasant, comfortable, and have no pain. And I am stretched through. Yes, thank you very much to the Sylvia. Many thanks. Until next time.